living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
In some places, the life expectancy of Native Americans is 20 years shorter than the national average. There are many reasons for this. One reason is their struggle to get adequate care. Today, we'll hear about challenges and how Indian Health Service, tribal health departments, and urban Indian centers work to overcome them. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Welcome back. Joining us first this morning is Dorothy Dupree, who recently retired from her position as the Director of the Billings Area Office of Indian Health Service. Thanks so much, Dorothy, for being with us.
It's very much my pleasure. Thank you for inviting me.
So can you talk to us about Indian Health Service? How's it funded? Who does it serve?
Okay, certainly. The Indian Health Service is funded through appropriations from Congress. It's an organization established in 1955 or in the 1950s early. Depends on if you're part of, we're part of the War Department, then we transferred to the Department of Health and Education and Welfare, and then to Public Health Service, and then HHS. So we're embedded, we're one of the sister agencies within the Department of Health and Human Services. We were created to serve federally recognized tribes based upon treaty obligations and treaty rights.
So what services do IHS facilities provide?
We provide all the regular healthcare services at a primary care level. We refer individuals out for any other care that we cannot provide at the local level. And there are a lot of rules for that. It's not an insurance plan, but I can talk about that in a little bit. But we have two budgets. We have the health services budget, which is really the clinical care, the preventive care, the tribal health programs, to funding available for them to take over the Indian Health Service, which they have authority to do under the Indian Self-Determination Education Assistance Act. We also, our second budget is facilities, and it's healthcare facilities construction as well as sanitation facilities construction. Also carried within that is environmental health as well as medical equipment. Mm-hmm. So are the larger medical pieces of equipment that we have in our facilities.
Okay.
So with those two budgets, it complements and provides care for the reservations that we're located on.
What challenges does Indian Health Service face?
Well, the major challenge is underfunding and aging facilities, aging equipment.
What do the facilities do to overcome those challenges? I've been in some of them, and you're absolutely right, they are aged. Mm-hmm. What do they do?
Well, we do have authority as a federal agency to bill another federal agency, which is CMS, the Centers for Medicare and Medicaid Services. So we are the only agency under the Indian Healthcare Improvement Act that has that authority. And we use that income from Medicare, Medicaid, private insurance to supplement the appropriations. In the later years, the most recent years I should say, we've had the Medicaid expansion here in Montana. One of the major differences from other areas that I've been in is that we have such an poverty as well as isolation. So it's very difficult to get individuals enrolled in Medicaid, but we're becoming more and more successful, and I think much more successful because of Medicaid expansion here in Montana. So with that income, we've been able to upgrade a number of our facilities, and I think it was like Christmas. I mean, our providers and our surgeons were so excited because they were getting new equipment coming in, and that is something that they hadn't experienced in a long time. So it brought a lot of energy, not only to our our staff and our providers, but also to our population as they see the facilities being upgraded.
There are a lot of strengths with the Indian Health Service, I know that. Can you talk about some of those unique strengths and why do they exist with the Indian Health Service?
Well, you know, we exist to serve the Native population that have treaties, the federally recognized tribes. And I think much of our success is that we're located on the reservations. And it's through working with tribal leadership where we're authorized to have a facility placed there, and the land we lease from them and so on and so forth. But we also live on the reservations and get to know the people and the customs and interact, and I live among, and I don't know how else to put it, but gaining trust is much of that as well, getting to know the individuals and participating and observing ceremonies and things.
So does the Native American population have unique needs, and assuming that, how are those needs met?
Well, one of the shows that will be shown here is that of our trauma-informed care. And we have high levels of trauma in our population. And anyone who has done any research or study or interest in trauma-informed care, traumatized populations will take note that those same populations have higher instances of illnesses. So we have high rates of cancer, high rates of diabetes, high rates of substance use disorders. So it's very costly. We have glaucoma amongst our population, again, and talking most recently to an oncologist in one of our private sector hospitals who found out what my position was at that time, and as you've known, I'm retired, but he indicated that he was worried because he didn't understand why the Indian population was dying at faster rates. And of course, my response back to him was, it's trauma in our population. And we have to understand and work closer with the trauma. But because we have a greater understanding of the population, we have high success rates. Most recently, we're able to demonstrate high success rates in diabetes, controlling diabetes and increasing our A1 factors.
Oh, that's wonderful. Thank you, Dorothy. Indian Health Service is one part of Native American health and healthcare. We'll pause here for a short break, and up next, we'll learn about another part of IHS, what it is and how it's different. Don't go away. Welcome back. Joining us now is Rosemary Edison from Browning, the Blackfeet Tribal Health Director. Thanks for being here to discuss the work you do.
Thank you.
And I know it's very important work, and our viewers are looking forward to hearing from you.
Yeah.
So the first question is, can you give us a basic overview of your program and the tribal health programs in general?
Sure. Tribal Health is a 638 program that currently oversees 17 health programs in Browning.
And so it does this in Browning only, or is it throughout the state?
Basically on the Blackfeet Reservation is where we do all of our work and have our programs and do outreach work within the whole community. I mean, like East Glacier, Babb, Heart Butte, those outlying communities, we reach out to them as well.
So we know a bit about Indian Health Service. We've talked about that before. But can you describe the difference between the programs that you direct and the Indian Health Service, and then talk about the different types of people that are served by each?
Okay, so Tribal Health, like I said, is a 638 program, and 638 is when the tribe contracts a program from IHS, and we currently have 5. We have Tribal Health, CHR, the Crystal Creek Treatment Center, EMS, and our IHS Security. And with the other programs, they're through various grants, and some funding from the state, SAMHSA grants and grants from IHS. We do serve all the same people on the reservation, and the services. What's different with IHS and Tribal Health is we go after funding where they get their funding yearly, so they don't have to go out looking for funding.
That's an important distinction. So you and your program go after grants and funding, whereas the Indian Health Service is federally funded.
Yeah, yeah.
So what is your background, Rosemary?
I've been in the business health business since 1998. I came on working with the diabetes program. Sort of worked my way up, started out as an outreach worker, then the office manager. Then I became the director, and I directed the diabetes program for 10 years. And then 2013, the Blackfeet Tribal Health position came available, and I applied. And so I've been with the Tribal Health since 2013.
So as part of your position then, do you travel across the state?
I do, yeah. Like I said, I was just in Bozeman the other day, in Helena here today. Yeah, I go out of state and state, just all over. And a lot of times while I'm traveling, I do make connections, and we do find funding just with visiting, finding someone, letting them know what we need, and so business cards exchange, and we're finding funding, so.
What are the challenges that you face as in your role really as the Tribal Health Director?
I guess speaking for Blackfeet, just finding people qualified people to fill certain positions. And of course funding is always, like I said, we're always going after funding to help find programs to serve our people. I guess just, we do have qualified people, but there's certain positions, say like a mental health specialist, a license, so just finding those folks is hard, I guess.
How many employees do you have then?
Within Tribal Health?
Yeah.
There's well over 100 with all the programs that we have. Yeah.
Okay. So mental health, you talked about that's a challenge, and it's a challenge nationally. We hear about that.
Yeah.
So there's a big shortage of mental health professionals.
Yes.
And I think in our rural states, that's particularly a challenge. How do you mitigate that challenge? What do you do?
Well, currently we have this new grant called Native Connections, and with this grant, we identified 10 people with their MSWs that still need to be licensed. So within the 5 years, we're working with these 10 people on getting their hours. I believe they have to do like 1,500 or maybe 3,000 hours.
Okay.
I'm not quite too sure, but just making sure that they get licensed within that time. And we're already working with these folks. So we'll have 10 licensed mental health specialists.
That is fantastic. And those 10 will serve your area,
Yeah.
in the Browning area.
They're already there. They're already working within the schools in different areas, and they're working on getting their license, their hours. So,
What's new with tribal health programs? What's the latest thing?
I want to talk about our medicated assistant treatment program. We're excited to get that. With the high rate of babies being born drug affected, we were able to secure 3 grants to help get that put in place. So we're just very new with that. We'll be working with moms and their mates and helping them. Well, they'll be doing daily dosing, and then we'll do wraparound services with helping them to get them back on their feet. And so we were just very excited about that.
What an exciting new program.
Thank you.
Thank you so much. That was great information. Next, we're going to hear from an urban Indian center and how they provide a healthcare option for American Indians who don't necessarily live on tribal health lands. Stay with us. Welcome back to Healthy Living for Life. We're joined now by Deshane Barnett, the Executive Director at Missoula Urban Indian Health Center. Thanks for being here, Deshane.
Yeah, thank you for having me.
What are urban health centers?
Yeah, so the Indian Health Service system is divided into 3 tiers. So there are clinics and hospitals that are operated directly by the federal government. There are clinics and hospitals that are operated by tribes, and then there are 41 urban Indian health centers throughout the United States. We're standalone nonprofit organizations that receive funding from the Indian Health Service to provide services in urban areas where American Indians reside.
So what do the statistics look like comparing urban folks that are living in an urban area and the more rural?
So one thing is that there are more American Indians living off of the reservation than living on. So about 78% are off the reservation, 71% are living in urban areas, metropolitan areas. So, roughly 7 out of 10 American Indians live in a metropolitan area. So if they're going to get services, they either have to travel, sometimes a long distance back to a reservation, or they can come to an urban Indian health center, if they're lucky enough to have one in the town that they live in. And so we provide a lot of services, and I don't know if this is also where you were going, but health-wise, statistics, people are surprised to hear that urban Indians actually tend to have higher rates of chronic disease, higher rates of poverty, higher rates of unemployment than even on the reservation a lot of times. So we're dealing with all of those issues, but we're doing it in a setting in a larger city instead of out on the reservation.
So there's a lot of challenges that you're facing. Well, how do you overcome those challenges?
Piece by piece.
Long sigh there, right?
Yeah. So our centers really have to be comprehensive and be the hub for the community, because we have to be addressing all of the social determinants of health. So we're obviously trying to provide direct medical care, but we're also providing mental health services, substance abuse services, we provide dental services, and then we also have to try to provide services that support education, employment, housing. We can't, if someone comes into our clinic, we can't give them a shot to make them better and then send them out into a situation that's unhealthy. That's just not the way it works. They're not going to get better. So we have to work on making their entire environment healthy, and it's a challenge.
So you're with the Missoula Urban Indian Health Centers.
Yes.
So what services do you provide? You've touched on that.
Yes, so we actually were lucky enough that in September of 2018, we just got our first full-time medical provider. So we provide full-time primary medical care services. We do provide some very limited dental services. We're hoping to ramp that up later this year. And then we provide a lot of mental health, substance abuse services, and then also community health services. So we do a lot of things like diabetes prevention, diabetes self-management, traditional foods, healthy foods, sustainable living, things like that.
How many staff, out of curiosity, at this
Right now
center?
we're at 21.
Okay.
Yeah.
So do the urban Indian health centers look the same across the nation, or is there anything unique about the one in Missoula?
Well, yeah, so we are actually one of the smaller ones. We're sort of a fledgling. But even at that, the saying is that if you've seen one urban Indian health center, you've seen one urban Indian health center. They can vary greatly in budget, staff, services, location, patient mix. Some might, be located in an area that has maybe a lot of representation from 1 or 2 tribes. Others are in places, for example, our clinic, we see people from over 50 different tribes. So it just really depends. No 2 centers look exactly alike.
So earlier we learned about Indian Health Service and tribal health service programs. What are the differences between those and an urban Indian health center?
Well, the biggest difference for me is that urban Indian health centers are 1% of the total IHS budget. So, like I mentioned before, 7 out of 10 American Indians live off the reservation. We're trying to meet those needs on an extremely limited budget. So 1% of the total IHS funding goes for urban Indian health programs, which means we, in current day lingo, we have to hustle. I have to, every dollar that I get from IHS, I have to leverage for several other dollars from somewhere else. Otherwise, I'm not going to be able to meet the needs of the community.
So what about the three of you different entities? Do you all work well together, play in that sandbox well?
Yeah, actually, one of the great things here in Montana, we have the American Indian Health Leaders, whereas that's all of the tribal health directors from every single tribal health program and all of the urban Indian health leaders and the IHS all at the same table. Not only do we meet in person quarterly, we talk to each other on the phone every week, once a week. I mean, we really do work to support each other as best as we can, because eventually we are serving the same population. I'm serving their aunties and uncles. Sometimes we're serving the same folks. They live on the reservation for a year, they come down to Missoula for a year. They're going to school here, they're here for 3 or 4 years, they go back to the reservation. So our populations are not separate, it's the same population. So we work together, I feel like we work together really well.
Wow. Well, we've got a little less than a minute left. So can you talk about what you've seen change over the years, the population you're serving?
Yeah, so what's happening is that with the younger population, they are in a really weird place where they absolutely do inherit the trauma, but they don't have as much access to the cultural traditions that we had in place to support healing. And so that's one of the things that the urban centers like myself really have to try to bring back to them. Whether they know it or not, they are carrying the trauma of their parents, their grandparents, even their great-grandparents, but they don't necessarily have access to those traditional healing services. So we bring those to them, and hopefully we can see a shift in that.
Oh, thank you so much, Deshane.
Yeah, well, thank you for having me.
Thank you to our special guests and to you, our viewers. We'll see you next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.